Hello everyone, myself Dr. Monalisa, and today we are going to discuss Clinical Anatomy MCQ Session 5th. So, targeting INI-CET examination 2021. So, this clinical MCQ series which I have started will be beneficial not only for cracking the INI-CET examination but also for the NEET PG entrance examination. So, let's start with the session. Okay, so now before starting the session, I would like to give you a brief about myself and about the platform of Unacademy. So, I have got a total of 8 years of teaching experience, and this is my referral code which can be used by you. This is an ad 10 for taking the subscription of Unacademy or watching the free sessions on the Unacademy platform. So, this is my code which can be used for unlocking the free sessions on the Unacademy platform. So, also I want to tell you about the free sessions which I am going to take tomorrow and today, which you can attend. So, let me tell you. So, just now I am taking the 3 p.m. session of INI-CET MCQs, and at 4 p.m. I will end this session in another 45 minutes, and then again I will start another session of on the YouTube's channel Let's Crack NEET PG, which will be targeting the 6th part of the Anatomy MCQ series, Clinical Anatomy MCQ series. And at 6 p.m. on the Unacademy platform, I am taking the session of the deep cervical fascia. So, those who want to attend this session, this is a session of conceptual anatomy teaching. So, you can join me and you can see the link of my session on Let's Crack NEET PG group, and also the group of mine, that is the Monalisa anatomy. So, there the link of the session will be provided, and those who are watching or downloading the Unacademy app for the first time, they can use the code ANAT10 for unlocking the free sessions on the Unacademy platform. Now, I also want to share the details of Saturday and Sunday, that is 10th and that of the 10th and that of 11th July. So, these are the 4 sessions. These 4 sessions I am taking on these 4 are the special free sessions. So, these special free sessions again I am taking on the platform of Unacademy. So, those who want to be the part of these MCQ series, okay. So, this is the must know clinical anatomy MCQ sessions for targeting INI-CET and NEET PG entrance examination. There are 4 sessions I have planned. So, subsequently on the 10th July and that of 11th July, that is Saturday and Sunday, to do join this session. This will be highly beneficial for the aspirants, and you can be the part of this session. Yes, Vikas Datta, hello, BM, hi. So, and this is the Telegram group of link of mine where the session link will be provided. Now, my dear friends, boost your preparation for the NEET PG entrance examination and various medical competitive examination by taking 3 months of subscription and getting additional 1 month of subscription absolutely free. You can take 12 months of subscription where 2 months of subscription additional is absolutely free. Now, also limited time offer is there for the iconic subscription where the Unacademy and the Prep Ladder platform has been merged. So, it is highly beneficial for the students who are targeting their entrance examination. They should go for an iconic subscription. Then here the merging of Prep Ladder live session along with the Prep Ladder recorded session QBank series along with the live session of Unacademy has been merged. So, these are the discounted rates, and over this discounted rate again you can get an ad 10. You can use the code ANAT10 for additional 10% discount. So, this will be highly beneficial. So, do join the iconic subscription. I will tell you about the benefits of this subscription also. So, how you are going to take the subscription. So, you have to firstly download the app, the Unacademy app from the Play Store, and after that you have to find your goal, that is NEET PG, and after that you can choose for the plus subscription. In the plus subscription you can be the part of live sessions of the Unacademy platform. So, it's always live sessions are going on the platform of Unacademy, and various top educators of the Unacademy platform are taking live sessions, and for various structured courses, whether it is structured courses, whether you are targeting the prof examination, whether you are targeting the INI-CET, NEET PG, NEXT or FMG. So, structured courses are there, and in a continuous process the sessions and live sessions are going on. Every 4th session is a doubt clearing session on the Plus platform. Live tests and quizzes are there, unlimited access is there. So, at times what happens, due to your academic load and due to your workload or personal responsibility. At times you are not able to attend the live session, so what you can do, you can watch that recorded version number of times. There is no limitation there on the Unacademy platform that you can watch 2 times or 3 times. You can watch number of times as you wish. And again, for taking the plus subscription, do choose the code NEET10 for 10% discount. Now, what are the benefits of Iconic subscription? In Iconic subscription, you get printed notes of the prep ladder. So, you get printed notes, prep ladder notes, you get video lectures, recorded video lectures of the prep ladder along with the QBank 3 series now. Rapid revision courses are there, live classes, batch courses, live tests and quizzes which were already on the Plus platform. That benefits is add on with the prep ladder. So, you can go for Iconic subscription. Those who want to target the entrance exam, I suggest that they should go for Iconic subscription, and again 10% discount is there if you use this code. Now, I also want to discuss the price rate and costing of both NEET PG subscription and that of the Iconic subscription. So, there is a comparison given between both of it. So, this is the rates of the Plus subscription. You can either go for 4 years, 3 years, 2 years, 1.5 years, 1 year, 6 months or 3 months. These are the rates and these are the discounted rates, and over this discounted rate again another 10% discount can be given, can be taken by you by using the code NEET10. This is the rates of the Iconic subscription, whether you are taking it for 3 years, 2 years or 1 year, and all these description has been given. So, monthly monthly costing is very less. You approximately 1200 is the monthly costing if you go for if you take 4 year subscription, and if you go for NEET PG subscription, and if you take Iconic subscription, it is also very less, it is just 1600 approximately. But after that again another 10% discount is given, so the cost is again lower down. Now, a new thing which is added on the platform of Unacademy is 4 year subscription. This is highly beneficial for the students who want to start their preparation right now from the first year. So, what is now known to everyone, that is the next is coming. We know that next is coming, and next first examination is going to happen in 2023. This is 2021. That means the students from first year itself want to target this exam. So, if you take 4 year subscription, the first prof, the second prof and that of the third prof examination of your MBBS course will be done along with the great educators of Unacademy platform. Though these great educators not only target and tell you about the university question pattern, long questions, theory papers, the practical, the Viva examinations, you will get prepared for your all prof examination, but along with that you can also have a preparation of next. And at the time when it's approximately in the final year when you are targeting your next exam, so you will also have till that time the subscription and you can target your next exam also. So, this is highly beneficial. So, go for it and have an additional 10% discount, and the rates are quite low. It's just 60,000 for the Plus subscription and 75,000 for the Iconic subscription, and that approximately comes 37 rupees per day for comes, and approximately 42-43 rupees comes for per day for Iconic subscription. So, extremely costing is low. So, what are the new things which is added on the platform of Unacademy is the raise your hand and have an conversation, get your doubt cleared right itself in the live classes, and it will give you a classroom like a feeling, and you can directly interact with the top educators of the Unacademy platform. Also, MedMind scholarship is coming along, so don't miss that opportunity. So, 10th July is the date, go for it. Okay, 10th July is the date, and the topic is pathology slides. And if you are getting rank 1, my dear friends, 100% scholarship to the plus 1 year subscription is absolutely free. If you are taking 10 to 19 rank, you get 25% discount on so you get 25% discount on taking 1 year subscription. So, this is highly beneficial, go for it. All the best. Now, the batches which is coming up. So, the batches which is coming up on the platform is the focus batch, FMG batch taken by the top educators of Unacademy platform. The other batches are Target Next 2022 batch is the Target Next 2022 batch, and the professional second year batch. The other batches are integrated clinical batches starting from 14 July, and the integrated clinical batches, these you can see exclusively clinical subject along with the live interaction with the top educators of Unacademy platform. So, this will be highly beneficial for it. So, go for it. Okay, and my dear friends, one more phenomena which is added on the platform is the Bucks-Bounty phenomena. So this is highly beneficial for the learners. What they can do is they can report any inappropriate content in the video, the first one to report, and if it is correct, what will happen? You can get a prize for it. Okay, so just go for it. Bucks-Bounty. Okay, now let's start with the MCQ session of today. So let's start with the first MCQ for today's session. Okay, so and then let's start it. Okay, so question number 1. So I will read it for you and I will give you 30 seconds to mark the correct answer. An anteroposterior radiograph is taken on the lumbar region in 31-year-old female patient who had been treated for tuberculosis, spondylitis at the vertebral level of T12 and L1 vertebra. The patient has been asymptomatic for 10 years. A density is detected. A calcified tuberculous abscess is suspected. So which of the following is most likely the calcified tuberculosis abscess involved in which of the following structures? So either it can be the body of pancreas, cecum, the fundus of the stomach, the psoas fascia, the suspensory ligament of duodenum. So mark your answer. Your time begins now. 30 seconds is given to you. So please mark the correct answer. All the best. So yes, Vikas Datta, BM, go for it. Question number 1. Okay. So either it will be A, B, C, D or E. Anyone wants to give the answer so that I can come up with the explanation? So yes, Akriti is telling body of pancreas, body of pancreas. Okay. What about others? What about the others? Okay, so let me come up with the explanation. Akriti, okay. So actually the correct answer for this MCQ is, if we go for the correct answer is psoas fascia. D option is absolutely correct. Okay, so actually psoas muscle is covered by a fascia that is called as psoas fascia, and it originates from the transverse process of intervertebral disc. It originates from the transverse process intervertebral disc and the bodies of the vertebral column, and the level corresponding is T12 to L4. Okay. So the question is also described as tuberculosis spondylitis T12 to L1. So actually the whole of this area, so we know that psoas muscle and psoas region is quite common for psoas abscess. So we will go for the D option as absolutely correct. Okay. So as described in the question, the fascia content is of calcified tuberculous abscess, and we know that psoas abscess is a quite common feature which is seen in the psoas muscle. So we have to go for psoas fascia because it is directly attached with that of the transverse process intervertebral disc and bodies of T12 to L4 lumbar vertebra. So this is the correct answer. Okay, so this is the correct answer. So I have given you the reason and why psoas fascia is the correct answer. Just now I have explained. Now what about the other options? Okay, what about the other options? Body of pancreas. Now body of pancreas is an elongated structure which, if we have to choose one, okay, yes, I know that body of pancreas is quite confusing for you. Yes, Rituraj, welcome to the session. So yes, it can be confusing for you because the location of the body of pancreas is also corresponding to L1 and L2 lumbar vertebra, but it is an elongated organ located across back of the abdomen. It is more back behind the stomach. So the location is behind the stomach. If we talk about the location of body of pancreas, it is behind the stomach. Okay, so the location is behind the stomach and corresponding to L1 and L2 lumbar vertebra. So if we have to choose one, we will go for psoas fascia. Now the other option, cecum. Actually when we talk about cecum, it's a blind pouch like structure, okay, and it is lying in the region of right iliac fossa. So it can't be the right answer. Okay, fundus of stomach again can't be the right answer because it is lying inferior to the apex of the heart. So corresponding level just below the fifth rib, and it is lying more inferior to that of the apex of the heart. So it can't be, the location is not corresponding to the lumbar vertebrae or T12 vertebra. So it can't be the correct answer. Suspensory ligament of duodenum again can't be the correct answer because it is a fibromuscular band which is extending from which is attaching to the right crux of the diaphragm. Okay, so it is extending from duodenum to the right crux of diaphragm. So this is the reason that this could not be the correct answer. So we have to choose one, then we will go for the psoas fascia. So option D is correct. Option D is correct. Okay. So let me show you this diagram where I am showing you the psoas muscle. What you can see, the right and the left psoas muscle has been shown to you as shown in the diagram, and what you can clearly see if I enlarge so what you can see, it is originating from T12, L1, L2, L3 and L4 lumbar vertebra and adjoining the intervertebral disc, as you can see, and transverse process. So this is the most, and also the description which was mentioned in this clinical question, siding with the psoas abscess and calcification. So all these is targeting the correct answer, that is the psoas fascia, which is covering the psoas muscle. Okay. So let's move on to the second MCQ. Question number 2. So all the best to everyone, mark the correct answer. Okay. So I will read it for you. Question number 2. A 45-year-old man is admitted to the hospital with massive hernia that passes through the inguinal triangle. What is the other name of inguinal triangle? Hazelback triangle. Which of the following structure is used as a landmark to distinguish a direct inguinal hernia from indirect inguinal hernia? So all of you mark the correct answer. The time begins now. Option A is inferior epigastric vessel, option B is femoral canal, option C is inguinal ligament, option D is rectus abdominis muscle lateral border, and option E is pectineal ligament. Okay, Raj Ravi is telling A. What about others? What about others? Ritu Raj, Akriti, Vikas Datta, Jabesh. So I got one answer from Raj Ravi. What about others? What about others? Okay, Akriti is telling B, Seema Kumari is telling A. Okay, Seema Kumari is telling A, Akriti is telling B. Okay, so A and B is coming as the answers. So waiting for the others to give the answer. Okay, so I got Amol is telling A. Okay, Amol is also telling A. Okay, so let me come up with the right answer now. Okay, I will come up with the right answer and the correct answer. Most of you have given the right answer. The right answer is A. That is the inferior. Why this is the correct answer, I will explain. So the right answer is A. Okay. So this right answer is inferior epigastric vessel. Inferior epigastric vessel. The right answer is inferior epigastric vessel. Got it? Okay. Now let me just come up with the explanation. Okay. So when we are talking about the explanation of this, so actually what I have chosen and what everyone has given the answer, most of you, is inferior epigastric vessel. The distinguishing feature, if we want to distinguish the location of direct and indirect hernia, we go for the landmark, that is inferior epigastric hernia. As we know, the direct inguinal hernia is not passing through deep inguinal ring, but the direct inguinal hernia is passing through inguinal triangle of Hazelback. Okay, and inferior epigastric vessel is forming a boundary for the inguinal triangle. So what is important for that? Firstly, I would explain you the boundary and then I will come up with the other options. So let me first stress upon the correct answer. So yes, the first thing which I want everybody to note down, and then I will show you the location also. So the key distinguishing feature of a direct inguinal hernia, from that of indirect is that direct inguinal hernia is protruding from inguinal triangle of Hazelbacks. Okay, so the location of the direct inguinal hernia protruding out from which anatomical region is the Hazelback triangle or that of the inguinal triangle. And if we talk about the indirect inguinal hernia, it is protruding out from the deep inguinal ring. So indirect inguinal hernia is coming out through which area? It's coming out through deep inguinal ring. And there is a landmark deep inguinal ring, that is the inferior epigastric vessel. Inferior epigastric vessel is forming lateral boundary for Hazelback triangle, and lateral to it lies the indirect inguinal hernia and medial to it lies the direct inguinal hernia. So this is the key point which is yes, absolutely right, Raj Ravi. So this is the key point for differentiating both kind of herniation. So let me again show you this diagram. In this diagram, let me just enlarge this diagram. I want you to locate the boundary of inguinal triangle or the Hazelback triangle. So I have highlighted this diagram. Now my dear friends, let me firstly outline this. So what I am outlining here, this triangular space is the inguinal triangle of Hazelback. This is the inguinal triangle of Hazelback, as you can see here. Okay. Now inguinal triangle of Hazelback, what you can appreciate that this is the rectus abdominis muscle. Okay, this is the rectus abdominis muscle. So here this rectus abdominis muscle is forming which boundary? Rectus abdominis muscle. So actually lateral edge of rectus abdominis muscle is forming the medial boundary. It is forming the medial. So I am writing M here. It is forming the medial boundary of inguinal triangle. Now my dear friends, what you can see, these are inferior epigastric vessel. These are inferior epigastric vessel, and you can see it is this inferior epigastric vessel is forming lateral. It is forming lateral boundary for that of inguinal triangle. Inferiorly, when we go more inferiorly, you can see this is the iliopubic tract, which is also having inguinal ligament attached here. This structure is inguinal ligament. This is the medial aspect of this inguinal. So this is inguinal ligament, and inferiorly, as you can see, if we go inferior boundary, if we talk about inferior boundary of Hazelback triangle, it is formed by inguinal ligament or iliotibial tract, inguinal ligament. Yes, Ravi Raj, absolutely right. So we have seen the boundaries, and now we are very clear about this space which I am highlighting with pink color. This pink color space which I am highlighting it, this space is the inguinal triangle, which is also called as Hazelback triangle. So now it is important to note down that herniation, okay, we know that two hernias are there, one is the direct and other is the indirect. Now you can locate, so let me just so let me just show you the location. So I am just, this is deep inguinal ring. So what you can see, this deep inguinal ring is lying lateral to inferior epigastric vessel, and the location of this Hazelback triangle is lying medial to that of inferior epigastric vessel. So as I told you, inguinal triangle से क्या traverse कर रहा है हमारा direct inguinal hernia. So it will come across medial to the location of inferior epigastric vessel, and that of the herniation which is taking place in the deep inguinal ring will come lateral to that of inferior epigastric vessel. So I think this is clear to you, everyone. Yes. So yes, many of you have absolutely given the right answer. Okay. So absolutely right. So please note down, this is a very important clinical point which many of you must be knowing. Those who are not knowing, you can revise it. So direct inguinal hernia. Direct inguinal hernia or herniation occurs through Hazelback triangle, Hazelback's inguinal triangle. That means it is herniating medial to inferior epigastric vessel, medial to inferior epigastric vessels. And when I am talking about indirect inguinal hernia, the herniation is occurring through deep inguinal ring. The herniation is occurring through deep inguinal ring, And my dear friends, the herniation is occurring through deep inguinal ring and the location is lying lateral to inferior epigastric vessel. Inferior epigastric vessel. So, this ways we have come to the correct answer. Okay. So, we are now knowing the correct answer, my dear friends. Now, so we have already done with this. Now, I just want to again move on to the options which was provided in the MCQ. So, we have already marked the correct answer, no doubt about this. We have already marked the correct answer. Now, why the other options are incorrect? Okay. So, let me just move on with the options. Is it okay? So, let me just move on with the options. Okay. So, we have already seen the correct answer and we have known that A is the correct answer. What about the B? So, why B is not the correct answer? Okay, femoral canal. So, femoral canal is actually a feature of femoral sheath and this is a feature of femoral sheath and we know that it passes beneath the inguinal ligament. So, this femoral canal is a part for middlemost part of the femoral sheath and it is passing beneath the inguinal ligament and then it reaches lower down. So, this can't be the right answer. Inguinal ligament, we know that it is actually forming the inferior boundary of femoral, it is forming the inferior boundary for the inguinal triangle and it is forming the base for the femoral triangle. So, it can't be the location. Rectus abdominis muscle is also forming a boundary for inguinal triangle. So, it can't be the correct answer. Now, pectineal ligament, actually when we talk about pectineal ligament, it passes behind and deep to the proximal end of femoral canal. Femoral canal. So, again it can't be the correct answer. So, this is the reason it can't be the correct answer. So, all other options are absolutely wrong except the A option. So, I think is it clear to you? Can we move on to the next MCQ, that is MCQ number 3rd. So, let us move on to question number 3rd. Got it? Okay, so let us move on to question number 3rd. A 25-year-old woman is admitted to the hospital with a sharp pain in the left lower quadrant. Patient history reveals that her last menstrual period was 10 days ago. Transvaginal ultrasound reveals a ruptured cyst onto the left ovary. The sonogram also reveals approximately 100 ml of fluid in the pelvis, which presumed to represent the cyst content and bleeding from the ruptured site. So, where is the fluid most likely located? The options are A, right subphrenic space, hepatorenal pouch of Morrison, paracolic gutters, vesicouterine pouch, rectouterine pouch of Douglas. So, all of you give the right answer. So, I will wait for 30 seconds and then I will move on to the explanation of this MCQ. So, all of you, your time begins now. So, Raj Ravi is telling E. What about others? Raj Ravi is telling E. So, here the key points is that the fluid is in the pelvis. So, I would like to tell you about the key points. The fluid is in the pelvis and it is due to the rupture of cyst and bleeding rupture site. So, it is due to the cystic rupture of the ovaries. Left lower quadrant में pain हो रहा है. So, 100 ml of fluid is accumulated in the pelvis. So, you have to tell me the correct answer. So, yes, Sudhadeep is telling E, Raj Ravi is telling E. Okay, what about others? What about others? So, yes, Seema Kumari is also telling E. Okay, so I am getting more of E answers. So, 3 of you have given the answer E. Okay. Pouch of Douglas, Akriti is also telling it's E. Okay. Yeah. So, option A is right subphrenic. So, let me explain with the correct answer. So, pouch of Douglas. Yes, yes, Akriti, I got your answer. So, yes, the correct answer is E, that is given by most of you, that is rectouterine pouch of Douglas. Okay. So, actually the whole scenario, the clinical scenario is telling you that the fluid accumulation is in the most dependent part of the pelvis, in the that is the rectouterine pouch of Douglas, because it's the lowermost and the most dependent part of the pelvis. Okay, accordingly the reason of fluid accumulation is because of that rupture of the cyst, which is also given, and this is the reason the correct answer is rectouterine pouch of Douglas. So I would also like to rule out the other options. So firstly, what I will want to explain you about the whole of the options, and then I will also show you few images so that you can locate the spaces. Okay, so correct answer, as I already told you, rectouterine pouch of Douglas. The reason is that it is the most dependent part of the pelvis, also during the standing position, and the fluid accumulation will be occurring in the pouch of Douglas. So the reason of fluid accumulation here is because of meso-ovarium ligament causing the ovary to be located on this posterior aspect of the broad ligament, and because of the rupture of the cyst, the fluid accumulation occurs into the rectouterine pouch of Douglas. What about the others option? The right phrenic space, my dear friends, the right phrenic space is lying inferior to the diaphragm and superior to the liver. So this can't be the correct answer. Subphrenic space, that means it is lying inferior. This location is, the location of this space is inferior to diaphragm and it lies superior to the liver, So it can't be this can't be the location of fluid accumulation due to rupture of the cyst in the pelvic region. Hepatorenal pouch of Morrison, actually this is a quite dependent position of the abdomen, but in the supine position. When the patient is lying in the supine position, it becomes the dependent position of the abdominal cavity. And actually yes, Sudhadeep, yes. So what happens if we talk about this space, that is the hepatorenal pouch? Yes, you are right that renal rupture and all other causes can be the reason of fluid accumulation, and this hepatorenal pouch is located between the liver. It is, exact location is lying between the liver and that of right kidney and right suprarenal gland. Yes, absolutely right. Supine position, right suprarenal gland. Yes, Ravi Raj is absolutely right. Right suprarenal gland. So Ravi Raj is absolutely right, and also Subha Deep. Okay. So hepatorenal pouch is the deepest space of peritoneal cavity and the dependent position of the peritoneal cavity, but the condition is that the patient should lie in the supine position. So this can't be the right answer. What about the paracolic gutter? Why it can't be the right answer? Actually these are the location which is lying lateral to ascending and descending colon, and this can't be the right answer as because of the location. Vesico-uterine pouch. What do you mean by vesico? Means urinary bladder, uterine means urinary uterus. Okay, so actually this is the space which is located between the bladder and that of uterus. Okay, and it is separated from the ovary by the mesentery of the broad ligament. Actually double layered mesentery, there is a double layer mesentery, that is the broad ligament, and this broad ligament and double layer of mesentery is separating this space, that is vesico-uterine space, from that of rectouterine pouch of Douglas. So again, so this is the reason the correct answer is rectouterine pouch of Douglas. So we have done with the explanation. What I want next is to show you the spaces. So see here, the exact location of rectouterine pouch of Douglas is between, posteriorly lies the rectum upper part and anteriorly it is lying the uterus, and this dependent space which you are seeing, which is exactly this space which you are seeing exactly between the uterus posterior aspect cervix to that of the rectum, is the dependent position of peritoneal cavity when the patient is lying in the erect position. Now coming to the next space which I want to show you, let me slightly enlarge this diagram so that it can become more clear. So I want to show you the two spaces. One is the subphrenic space. This is the subphrenic space, and clearly in this diagram you can see it is the space which is lying in between the liver and the diaphragm. Okay, it's a space lying inferior to the right diaphragm, and this is the diaphragm and liver in between the subphrenic space is lying. Hepatorenal space of recesses or hepatorenal space or pouch of Morrison is the space which is located between the liver and that of right kidney and suprarenal, this space. Okay, this is the space. Okay, so this is exactly not lying in correct relation or dependent position in terms of pelvic region. Okay. So here I want to show you the paracolic gutters which is lying on either side of ascending descending colons, these area, and this is also not the area to be involved in case of the rupture of the cyst of the ovary. This is not in there. So I also want to show you a diagram. Also you can see in this diagram that vesicouterine pouch, as I told you, this is the vesicouterine pouch, this space which is lying between the uterus and the bladder, and you can see it is lying anterior to rectouterine pouch, and it is separated from rectouterine pouch by the broad ligament. So it can't be the correct answer. Now I want to show you a diagram in which I want to explain that when the person is lying in the erect position. So see here, when the person is lying in the erect position or in the semi-erect as sitting position, the dependent part of the peritoneal cavity is rectouterine pouch of Douglas. As you can see, and so the correct answer. So that is the reason this is the correct answer. Now when you will see the right subphrenic space, okay, right subphrenic space or Morrison's pouch, what is this space? This space is the dependent position for peritoneal cavity, but in the supine position, So that is the reason it is the wrong option. So absolutely right. Let's move on to the next MCQ, that is MCQ number 4th. A 54-year-old man underwent a gastroscopy, he underwent a gastroscopy, okay. Okay, which reveals a tumor in the pyloric antrum of the stomach. A CT scan was ordered and evaluated for the lymph node involvement. So which of the lymph node is initially draining the pyloric antrum? So options are the celiac, the superior mesenteric, the inferior mesenteric, the lumbar and the hepatic. Your time begins now. Please mark the correct answer A, B, C, D, E or E. So yeah, Subhadeep Raj Ravi has given the answer. What about others? Question number 4. So waiting for the others, and then I will come up with the explanation. So it's a simple one only. If you are knowing the lymphatic drainage of the stomach, you can make it the correct answer. So yes, actually, two of you have given the right answer. The correct answer is A, and absolutely Raj Ravi and Subhadeep is absolutely correct. So we have got A as the correct answer. So for the explanation of this MCQ, what I want, actually what was explained, yes Kamal, you are also right. His underwent a gastros which reveals a tumor. The tumor location is pyloric antrum of the stomach, means stomach is mentioned here. So you have to tell me the CT scan is ordered and the lymph node involvement has to be judged, which is draining the pyloric antrum. So actually when we talk about the lymphatic involvement or lymphatic drainage which is following in the case in the case of abdomen and all, what happens, the lymphatic supply is following or lymphatic drainage is following the arterial supply. So as we know, the stomach is getting its arterial supply from the branches of celiac trunk, so its lymphatic drainage will be also in the celiac lymph node. Yes Akriti, you are also right. So after that I will show you this diagram. So one of the basic point for marking the answer correct is, and what I want to write here is that lymphatic drainage, the lymphatic drainage follows arterial supply of the abdomen. Lymphatic drainage is following the arterial supply of the abdomen. Okay. So lymphatic drainage is following the arterial supply of the abdomen. So we know that celiac trunk, CT for celiac trunk lying at the level of T12 is the major source of blood supply for the stomach. So lymphatic drainage will be in the celiac lymph node. So this is the reason that option A is correct. Superior mesenteric, inferior mesenteric, lumbar and hepatic are not the arterial supply for stomach. So this is not the correct answer. So that is the reason all other options are wrong. Now I want to show you this diagram. This is a simple diagram where you can appreciate the lymphatic drainage area. So what you can see, actually cancers of the stomach has got lymphatic drainage. Yes, Raj Ravi, yes, you are right. Yes, Raj Ravi, you are absolutely right. The direct branches of celiac trunk, yes, you are right, that hepatic, splenic and all gastric, right? So we have got left gastric, splenic and hepatic, common hepatic artery as the direct branches, okay. But pyloric antrum level is also seen, and we know that ultimately all the lymphatics will draining into which node? Celiac lymph node. So see here, so what you can see, the area around the greater curvature upper quadrant is draining into pancreatico-splenic lymph node, lower quadrant along the greater curvature is draining into right gastroepiploic node, and lesser curvature along left gastric and also right gastric nodes. Yes, Subhadeep, also common hepatic artery. These are the branches. But as we know, superior inferior mesenteric artery is not the prime arterial supply, as you can see here, and also lumbar hepatic, they are not the blood supply for the stomach. Celiac trunk and its branches are the blood supply, and along with it the whole of the lymphatic drainage of different quadrant of the stomach has been shown in this diagram, which will be helpful for you to quick revision of the lymphatic drainage. Yes, absolutely right. So can we move on to the next MCQ, MCQ number 5th. A 55-year-old woman is admitted to the emergency department with the complaints of abdominal pain. The pain was in the epigastric region, burning nature, occurred after eating of spicy or greasy foods. It improved with the tubal antacids and was not associated with shortness of breath or diaphoresis, and the physician diagnosis the patient was having gastroesophageal reflux disease. Which of the following organ is not derived from the same embryological structure as the patient's stomach? So actually this whole layout in this MCQ is actually telling you which of the following structure is not derived from the same embryological structure as that of the patient's stomach. So you have to rule out the option. Okay, so go through this MCQ and mark the correct answer, whether it's spleen, right bronchus, second part of duodenum, tail of pancreas and right lobe of the liver. Okay, so your time starts now. So the key point is already mentioned. So you have to know which of the following organ is not derived from the same embryological structures as the patient's stomach. So one of you is telling is B, right bronchus. Okay. So you have to think nicely and then give the answer. Okay. So once more think about it. The structures, you have to know that stomach is derivative of which structure. Can I give you the hint? Can I give you the hint or let others try? Stomach is derived from, okay, I am getting, so Kakti, Biki Kakti is telling it's spleen. So let me come up with the explanation. So I have given the hint and one of you, so let me tell what, let others tell, then I will explain. Okay, let others also attempt and then I will explain what is the right answer. So try. Okay, Raj Ravi, okay. So I have given the hint also. You have to focus on the stomach is derivative of which structure and then you can get the right answer. So actually we have got Biki Kakati is telling the right answer and the right answer is spleen. Yes. So yes, very nice answer by Biki Kakati. Okay. Spleen is the right answer. What is the hint which I want to tell you? That stomach is derived, it's a derivative of foregut. All of you, is it okay? Stomach is a derivative of foregut. Okay. So foregut के derivative को अगर हम include करें तो that is the upper and the lower respiratory tract also. So the bronchus can be the right answer. Okay. So actually pharynx, esophagus, first and second part of duodenum till the level of the opening of major duodenal papillae. pancreas, gallbladder, liver. All these structures are derived from the same structure as the stomach. So, these all can't be the right answer, because which of the following is not derived? You have to make that answer correct which is not derived. So, not derived is spleen. So, that is the reason spleen is the correct answer. So, spleen is derived from dorsal mesogastrium of the stomach. Yes, Raj Ravi has now got the answer. So, he got now. Okay. So, yes, that was the hint which was given by me, and I am very happy that Vicky Kakati has given the right answer, and also happy with all others because they are also not, they are now knowing the right answer. So, it happens. So, at first go it feels like bronchus respiratory hai, so ye GIT ka part nahi hai, so maybe that be the answer. But if you go embryologically, the derivative of foregut, then you get the right answer, and spleen is not directly the derivative of foregut. So, let me write this explanation so that you can revise it. Okay. So, write on the stomach. So, I am writing the explanation for those who want to revise it. Stomach is derived from foregut. We know that stomach is a derivative of foregut. So, the derivatives, so if we see the derivatives of foregut, they are upper and lower respiratory tract also, upper and lower respiratory tract also. After that there is a diverticulum form, and upper and respiratory, lower respiratory system parts. After that a diverticulum is formed, and then it separates the oral cavity and that of respiratory. So, larynx or pharynx and trachea is all separated. Okay. So, actually the upper and lower, so it is the derivative of foreguts are pharynx, esophagus, first and second part of duodenum, and we know that stomach to hai, we have just seen also, and also up to the opening of major duodenal papillae, up to the opening of major duodenal papillae. Okay, and also what others? Gallbladder, pancreas, and the liver. So this is, spleen is not the correct answer. If we talk about the spleen, let me come with the spleen. If I talk about the spleen, spleen is derived from dorsal mesogastrium of the stomach, So, A is the correct answer. Yes, absolutely right, Raj Ravi. So, yes. So, we got, this is the reason that A is the correct answer. So, my dear friends, can I tell you about my live sessions and upcoming sessions so that you can be the part of this session? Free live sessions on the Unacademy platform. You can be the part of these sessions by using the code NAT10 if you are seeing my sessions for the first time. So, you have to use this unlock code and you can be the part of free sessions on the Unacademy platform. So, my dear friends, just now after completing this session, 4 p.m. So, now it is going to be 3:30 p.m. 4 p.m. I am taking another clinical MCQ session second. So, this will be start in just another 10 minutes. You can join me for that. That is also consists of 5 MCQs, 30 to 40 minutes. I will cover up that MCQs. So, you can join me next. And 6 p.m. is the timing of today's deep cervical fascia. So, this deep cervical fascia, I am going to take this session on the special class of Unacademy. So, the link will be provided in Monalisa Anatomy group, and also this is my Telegram group, you can join, and also on the Let's Crack NEET PG group. Okay. So, the sessions detail for Saturdays and Sundays. So, I am going to take on Saturdays and Sunday 4 special sessions. So, please do join for these special sessions. That is on the 10th and 11th July. The timing has been given. The link of the session will be provided on the Let's Crack NEET PG platform and also on the Telegram group of mine, that is Monalisa Anatomy. And this is the referral code which can be used, NAT10, which can be used not only for taking the subscription of Unacademy, for unlocking the free sessions on the Unacademy platform. Okay, so I also want to just give you a quick revision of 4-year subscription, which will be extremely beneficial for you. So those who want to take the subscription of Unacademy for 4 years, if they are in the first and second year, so they can have the preparation of their prof examination, the first, second, third year prof examination, and also they can prepare themselves for their next examination. So the rates are quite low. For the plus subscription, just 60,000, and that of Iconic subscription, where the printed notes and along with the benefits of prep ladder is provided, along with the live sessions and the plus benefits of Unacademy courses. So you can join this and avail the opportunity. You can use my code NAT10. So this is my code NAT10, which can be used by you for additional 10% discount, for the additional 10% discount. Okay. So I also want to tell you before ending the session, I just want that you should once more go towards the NEET PG subscription details of the Plus platform and the Iconic subscription, where the rates are given, and I am coming up with the 21st July. So I will update about all. 21st July I am taking the course on the Plus platform. This is highly beneficial for those who are targeting next exam and prof examination. They can take the Plus subscription and be the part. They can join my sessions, which I am starting from 21st July. I will finish the entire course till November. So you can join me for the entire anatomy sessions. I will cover up all university papers, all the MCQs targeting for the next examination. This will be quite beneficial and conceptual. Those who want can take the Plus subscription. They can use the code NAT10 for additional 10% discount. So all the best, keep studying. Thank you so much, and join again 4 p.m. session for the more of clinical MCQ session. Thank you so much. All the best. Thank you everyone. Thank you. Good evening. Yes, Tasnim Haq, Raj Ravi, Sudadip. Thank you so much everyone. Thank you.